Welcome to Oncology Podcast News. I'm your host, Ellen Baker. This week's top stories include cancer deaths drop for second straight year and sunshine pill for prostate cancer in 2009. Decades of research into prevention, diagnosis, and treatment are paying off. A study by the American Cancer Society reported that the death rate of cancer dropped 2 years in a row. According to the report, 888,000 died from cancer in 2004. This is 3,014 less than the deaths in 2003, which itself showed a small drop of 369 cancer deaths from the previous year. Cancer is the second leading cause of death in the United States after heart disease. For more than a decade, the cancer death rate has been dropping about 1% a year, but the actual number of cancer deaths still rose each year because of the growing elderly population, and the overall size of population had outpaced the falling death rates. The improvement in survival reflects progress in diagnosis in certain cancers at an early stage and improvement in treatment, as well as the aggressive prevention campaign. The greatest decreases in mortality have been found in colorectal cancer, and there were 1,110 fewer deaths in men and 1,094 fewer deaths in women. Dr. Elizabeth Ward, the Cancer Society's Director of Surveillance Research, said that the decrease in the death rate reflects a declining incidence rate and improvements in early detection and treatment. The recent rapid decline was partly due to an increase in screening, which can detect and remove colorectal polyps before they progress to cancer. The screening procedure includes colonoscopy and stool examination. Dr. Ward also said that the decline in the cancer death rate was also due to years of effort and investment in tobacco control, programs for early detection and screening, and programs in clinical and basic research. Death rates from lung cancer in men declined by 1.9% a year since 1991. The female lung cancer death rates are approaching a plateau after continually increasing for several decades. The trend in decline was due to the decrease in smoking rates over the past 30 years. The report also showed that African Americans have a higher death rate than whites in nearly every type of cancer. This may be due to having less income, education, and access to health care, although inherent susceptibility may also contribute. For 2007, American Cancer Society estimates that 1,444,920 new cancer cases are expected to be diagnosed, and 559,650 are expected to die. And in other news, a tablet designed to emulate the healing power of the sun could be available for the treatment of advanced prostate cancer as early as 2009. But it remains to be seen whether the drug will be the revolution in prostate cancer care that its makers claim. The drug Acentar is based on vitamin D and is given to patients in the advanced stages of prostate cancer along with chemotherapy drugs. Drug makers came up with the idea because vitamin D from sunlight improves the prognosis of certain cancers, but taking natural levels of the vitamin has no effect. Novacia, the company that makes Acentar, produced a novel formulation that reproduces the healing effect without the dangerous side effects of a vitamin D overdose. If the ongoing Phase 3 trial goes to plan, the new drug should be available in 2009, reports Chemistry and Industry, the magazine of the SCI. Prostate cancer is the second leading cause of cancer death in men. Prostate cancer kills 1 man every hour in the UK. Thanks for listening. For Oncology Podcasting, this is Ellen Baker.